Hello, this is Dr. Sankalan Saha, DM cardiologist practicing at Dr. PK Saha Hospital, Kuch Bihar. Today we will be discussing about oral anticoagulants, their various uses and precautions to be taken when you are on oral anticoagulants. Let's have a look on the thromboembolic disorders. Thromboembolic disorders are various health conditions in which the normal flow of blood through the veins are blocked due to formation of blood clots as a result of thrombosis. These clots are formed inside our blood vessels and further carried by the blood flow to other sites and block other vessels. These disorders include deep vein thrombosis and pulmonary thromboembolism. Oral anticoagulants are blood thinning agents that prevent the formation of harmful blood clots and enable a smoother flow of blood through the blood vessels. Warfarin belongs to a group of oral anticoagulants or blood thinning agents which are used to treat and prevent formation of harmful blood clots in your body. It stops the clots from becoming larger and causing more serious problems. When a patient is on oral anticoagulants, we physicians and cardiologists prescribe an investigation that's called PT-INR. INR stands for International Normalized Ratio. When you are on an oral anticoagulant medication like warfarin, it is very important to monitor the effect produced by the medicine inside your body. This is done by performing a simple blood test called as PT-INR, which checks your blood clotting time. The test is performed on a blood sample withdrawn either from the patient's vein or fingertip. There are certain things we need to know when on warfarin, and what should I tell my doctor before starting warfarin. Whether you are having any bleeding problem, are you having history of frequent falls, any liver or kidney injuries, high blood pressure, any heart problems, diabetes, any other medical problems, are you a chronic alcoholic, do you drink alcohol often? Because alcohol can often affect the warfarin dose and should always be avoided when patients are on warfarin. Is the patient pregnant or planning to conceive? Is the patient breastfeeding? Warfarin may increase the bleeding tendency in babies. Please do talk to your doctor about the best way to feed your baby. If you choose to breastfeed while taking warfarin, both you and your baby should be carefully monitored for bleeding problems. Please tell your doctor about all the medicines you take, including prescriptions and over-the-counter drugs, vitamins, and herbal supplements. There are certain things what should be done while the patient is on warfarin. When warfarin is prescribed by your doctor will adjust your dose from time to time depending on your response to warfarin based on your PT-INR levels. Please take warfarin at the same time of the day every day. You can take warfarin. Warfarin should always be taken when there is no at the time of the day when there is no food or any other drug taken. Usually it's taken in the evening, preferably at a time like 6 p.m. or 8 p.m. when we are not snacking or we don't take any other medicines. A gap of 1 hour is mandatory between food or any other drug and warfarin in order to prevent food and drug interactions. Please do take regular blood test as instructed by your doctor to check how fast your blood clots. The test recommended in patients taking warfarin is PT-INR, as already we have discussed. Do not start, stop or change any other medicines or herbal products except on the advice of your doctor. This is because this can interact with warfarin and affect the dose of warfarin you need or increase warfarin side effects. Always keep a list of medicines with you at all times to show your doctor. Please do avoid alcohol consumption when you are on warfarin. Do not take warfarin during pregnancy or when you are planning to become pregnant. Use effective birth control if you can get pregnant. Avoid any activity or sport that can lead to traumatic injury. If the prescribed dose of warfarin is forgotten, please do inform your doctor immediately. Take the dose as soon as possible on the same day, but do not take a double dose of warfarin the next day to make up for the mixed doses, which can lead to deleterious effects. Avoid drinking cranberry juice, grapefruit juice, pomegranate juice, or consuming the related products. Do not change your weight by dieting without first checking with your doctor. Wear or carry information that you take warfarin. The amount of vitamin K in food may affect therapy with warfarin. Eat a normal, balanced diet, maintaining a consistent amount of vitamin K. Avoid drastic changes in dietary habits, such as eating large amounts of green leafy vegetables as they contain vitamin K. Certain vegetable oils also contain large amounts of vitamin K. When do you need to call your doctor? Call your doctor when you are sick, have diarrhea, an infection or have fever. Call your doctor immediately if you take too much of warfarin. Always tell your doctor and dentist that you are on warfarin. Tell your doctor about the planned surgeries, medical or dental procedures. Warfarin needs to be stopped for a short period prior to surgery, or dose needs to be readjusted and again started after the surgical procedure. Call your doctor immediately if you fall or injure yourself, especially if you hit your head. Your doctor may need to check you immediately. Things you need to watch out for when on warfarin. The most common side effect associated with warfarin is bleeding. Watch out for the following warning signs or events of bleeding problems and call your doctor immediately if you experience: number 1, pain, swelling or discomfort anywhere in the body. Second, headaches, dizziness or weakness. Unusual bruising, bruises that develop without known cause or which grow in size. Prolonged bleeding from cuts, nosebleeds, bleeding of gums from brushing, and menstrual bleeding or vaginal bleeding that is heavier than normal. Unusual bleeding for unknown reasons, pink or brown urine, red or tarry colored stools, coughing up blood, vomiting blood or material that looks like coffee grounds, death of skin tissue, pain in your toes with toes appearing purple or dark in color. This is what needs to be discussed regarding the patients who are on oral anticoagulation. Thank you very much for your patient hearing.